the patients we see for breast cancer, and like we know no one else in town can take care of them, and we're just trying to get them to the operating room as quick as possible to get the cancer out. And what do they say? Like they call the patient up and send them somewhere else that can't offer them what we offer.
You can call to set up a peer-to-peer on their timeline.
Yeah.
And
for them to tell you there's no way in hell.
This is not a code we recognize. Like, what the fuck are you talking about?
Or they'll tell you,
this is your regular code.
I was with you guys. I mean, I did a peer-to-peer the other day. And the lady was actually nice. But when I was with
they're all really nice now because they got cussed the fuck out for like 5 to 7 years. I'm serious.
Yeah.
Like, they were just like, they have to like back the insurance company's codes and tell you like actual shit that's not there or in your contract. And you're just like, no. So now they're more nice about it. It's like, oh, okay, we approve this code, but this code isn't. But they would just like straight up.
Yeah, they make you fight for it no matter what, though.
And then that's approved, and then
it's like you have to fight for the patient.
Well, you send them your medical records 30 times. I'm like, you don't need my medical records. You have everything from 20 other. You have it from the hospital. You have it from the other 5 people that took care of the patient.
I had that today, dude.
And like, I'm like the 6th person. You just need my op note, and you've received it 4 times.
No, even without the op note,
you don't need anything more.
Today it was peer to peer. Like, why do you think this patient needs this care? It was like, she has breast cancer. It's like, you need to submit more thorough notes. It's like, I gave you my note from my office, and you have notes from the medical oncologist, breast oncologist, saying she has breast cancer. She's going to have to undergo bilateral mastectomies. And you're telling me, like, I need to give you more evidence that she needs breast reconstruction? Like, are you fucking kidding me, dude? Like,
how about the one that told you, like, the patient doesn't get to choose what kind of reconstruction?
It wasn't just the patient doesn't get to choose. Yeah. That's what they come to. Sometimes they've learned not to. I haven't heard that in a long time.
That's
like
crazy.
A long time. I would say 6 months. But it's just like, okay, you want microsurgery, free flap reconstruction? There's multiple surgeons in network they can choose from.
Yeah, I was with
and I was just like, oh yeah, and it was on speakerphone. And I was like, who is it? Yeah. Give me the names. Like, don't worry, the names will be provided. I was like, I need to know those names because I'm going to call my patient and tell them your insurance has been denied. You can call this person or that person to get that done and can tell them what I feel about that surgeon. And they gave me, out of everybody in Arizona, Phoenix, the 5th largest city in the U.S., they gave me 2 names. And one guy I see in the hospital and I'm friends with, and he's told me for the last 6 months he doesn't do free flaps. And the other person hasn't done a single free flap since training.
Yeah.
It's like,
it's on their website though.
Yeah. And she
some
just
marketing
kept
firm
repeating that. And I was just like, I told her, and just like, well, just like, I was like, sounds like you got nobody in network to do free flaps for the 5th largest city in the US. And you have 0 repercussions for that. I was like, this is recorded, right? Just make sure this one's recorded.
Yeah, I mean, similar for me, being oculoplastics, like even coming in, the Blue Cross like automatically just was like, nope, we're not going to put you under contract. We have enough of you, sir.
Well, every one of our insurance companies did that. Our major carriers in Phoenix did that to you. Well, like Aetna did it, right?
Yeah, but that's the thing. There's only 12 oculoplastic surgeons, and probably 5 of them are actually even taking insurance. The other 7 probably took insurance at some point and are
even if all 12 did,
they don't want
probably be.
But there's 12. Yeah. Oh yeah. It's way underserved. It's 4 to 6 months to see someone, so it's a little ridiculous. So that's the barrier of even starting with.
You know what's the messed up part is? Somebody in Canada is watching this, being like, I can't believe these guys are complaining about this shit. They have it so good. They got 12 oculoplastics in the city? What the fuck?
And then,
they probably got 30, but they work 9 to 2 on Monday, Wednesday, Saturday or something.
I heard it twice today, actually.
And if they operate 2 operations a week, their drugs are cheaper.
I mean, that's just the beginning of the process, right? And that's our frustrations. And I think a part of that frustration comes to the other end of it for us specifically is luckily we have a good biller, right? But a lot of places, especially academic institutions, I'd say, and I'm just saying that because of what I've experienced personally at Duke, they bill these out, and there's surgeries that may take, 4, 5, 6, 7 hours, and the doctors don't even get reimbursed for it.
Well, it
their
varies
collections,
in different systems.
but collections are like 20%. It varies in different systems.
No, the biggest
20% of what is being billed out is being collected.
Well, they depend on you doing so much volume and without follow-up and appeals to be able, because that's why they deny everything the first time, because
there's no
absurd percentage of billing companies don't even appeal.
Exactly, and they know in a big system like that's producing so much that the people can't keep up with.
Yeah.
But
and this
how
is
is that? How is that okay?
How many cases?
This is the shitstorm.
How
we're
is that
like
okay?
in
like that's just insane.
Yeah,
it's like basically a free surgery. You just did something extremely complex.
Yeah.
Somebody can get a really bad complication from it.
Yeah,
possibly even die from a lot of these surgeries. They
do,
and you don't even get $1 for that.
Well, and like when I was doing like 3,000-4,000 cases a year, and like going through like as soon as you change billing companies, all your previous stuff, like whatever you haven't gotten paid for, and some stuff's like 3 years, 5 years old that you haven't gotten paid for, all that's like completely almost erased.
It's
once
tough
in a while
looking
you'll
at
get
it,
something.
Dude. It's tough looking at it.
Insane.
You're just like,
people
are like, oh, why don't you like do like work for people in this community before talking? We've talked about it before going overseas. Like, you know how much free work I've done over here?
Yeah.
Like, I donated like at some points like over 40 hours a week of free work.